So we're now going to just really quickly show the agenda again to let you know where we are. And as a reminder, Gina is going to change her time. I mentioned that she had an emergency. It'll probably be closer to 4:30. I know some of you have tuned in to see that. And we will be moving on to our next set of pitches. So we will be hearing from our seed and our Series A companies. And first up will be Rory. So Rory, if we could welcome you to our stage.
Hi, thanks so much for having me. Hi, everybody. My name is Rory Stanton, and I am the founder and CEO of Isla Health, and we are bringing virtual precision health for autoimmune disease patients. Next. What you may not know is that 1 in 6 Americans is actually living with an autoimmune condition, and half of those aren't yet diagnosed. What's more is that 75% of all cases are women. This is an underfunded, understudied, and underserved area of women's health, and we believe that needs to change. Next. Through conversations with family members and friends living with autoimmune diseases and the hundreds of patients I've interviewed since I started Isla, it's clear that the journey is extremely fragmented and complex. And that's because these diseases present differently in every single person, and they have to see a number of specialists. They're going and trying to figure out what their care plan should be because it needs to be unique to them. And of course, this all leads to higher healthcare costs. Next. Health plans and employers that we spoke to found this of particular interest. The average cost per year per an autoimmune patient can be anywhere from 5 to 25 times as expensive as the average patient, surpassing other chronic condition areas like depression and diabetes. Next. So what we did was build a virtual precision health platform, one that ingests a number of different data sources about a patient so that we can provide one longitudinal view into a patient's health history and help personalize autoimmune care at scale. Over time, we want to take those incoming data feeds and predict negative outcomes and flare-ups in advance for autoimmune patients. And utilizing our built-in virtual care and remote monitoring tools, we want to prevent unnecessary utilization of high-cost resources like hospitalizations and emergency department visits, and ultimately provide better holistic care for women living with these conditions. Next. Our solution covers the full spectrum of virtual care, so we really take a full stack approach, integrating telemedicine, remote monitoring, the ability to seamlessly schedule with a clinician. In the future, we'll be having at-home lab testing. We're currently enabling testing in local environments. We're also building out personal wellness plans for patients living with autoimmune. Everyone has a different set of symptoms and needs, and so they can work with our health coaches to design those both on the nutrition and overall wellness goals that they have. And then we wrap that around with a built-in patient community. Next. Finally, we couple that with an autoimmune aware and focused integrative care team. I think one of the most common things we heard in our patient interviews was that maybe their providers or primary care providers didn't necessarily know how to help manage the multifactorial issues that they were dealing with. And so they keep ping-ponging between all these different specialty care providers. Our goal is to put that all in one place and help support them if they're living with multimorbidity, which is extremely common with patients living with autoimmune conditions. Next. While there's many gaps in care that I've already spoken about, this is also a huge area of opportunity. On just 5 of the 100+ autoimmune diseases, $100 billion is spent every single year. And we feel that virtual is going to be a huge enabler of accessing high quality and high value care for autoimmune disease patients. Next. Initially, our business model is going direct to consumer, and the patient pays a monthly subscription fee to have all access membership to our clinical team. We're launching this right now. We're working in tandem to get in network with payers to support kind of better accessibility for all patients. In the phase 2, we'll be focused on providing value-based specialty care and working with health plans and value-based care organizations by participating in shared savings and at-risk agreements. Next. So far, we've built our proprietary multi-specialty clinical engagement platform, our iOS and Android apps. We're launching our virtual clinics in Colorado and California. as we speak and starting to enroll patients every single day. And we've set up a number of clinical partnerships to help drive patients to ILA and also help extend the points of care for where we cannot serve virtually. In the next 3 months, we're focused on, again, expanding access by contracting with insurers, building out our clinical outcomes data, and over time, end up wanting to be one of the preferred value-based specialty care providers with insurers and employers. Next. The team is led by a group of digital health experts, engineers, and clinical experts who are focused on improving women's health care and focusing on this specific unique need within autoimmune disease. Next. So our ask of the community today is, in terms of helping us kind of establish our next milestones, is really we're looking for partners at both health plans, employers who are looking to provide new options for their autoimmune disease patients living in their networks. And ultimately, if you know someone that's impacted by autoimmune disease, most likely you do, there's 1 in 6 Americans, as I mentioned, please share what we're doing at ILA and the mission we're on. Ultimately, our goal is to develop new evidence in this area of women's health and provide better outcomes for women living with autoimmune conditions. Thank you so much.
Thank you, Rory. Ella, do you have the first question?
Yes, thanks, Susan. So first of all, Rory, thank you for sharing that. What a great vision. And I love that you're using the concept of an integrated care team, so needed in often a siloed care environment. So I think that's great. I'm curious to kind of get a better sense of how you're thinking about the second phase in value-based care. What would be the value proposition to the payers, and how do you think about kind of the economics of that?
Yeah, so that's a great question. Thank you. I think in talking with a number of folks within the value-based care landscape, I mean, there's a number of different levers we hope to impact. Of course, one, cost reduction by closing some of these care gaps and reducing some of the cycling through that happens with patients. Ultimately, we want to drive patients to the right specialist at the right time and reducing some of that kind of unnecessary spend on the medical side. On this, on the outcome side, of course, we obviously want to drive better quality in care. And I think one of the things in terms of us building our own proprietary platform was we embedded all those analytics to kind of track quality measures, track patient-reported outcome measures in real time, so that our clinical team and our health coaches can monitor that longitudinally and support patients when they need it, rather than reactively when a patient's having an extreme flare-up. So those are two of the major levers that we're looking to pull with value-based care orgs.
Thank you. And other questions from our judges?
Hey, Rory. Quick question. Thank you for the presentation. Just curious if there are any particular autoimmune conditions that you think are kind of the best fit for this type of model.
Yeah, so we're initially starting with rheumatology, and we're also looking at gastroenterology. I think I mentioned in my presentation, one of the main challenges is many patients, I think it's the stats over a third, but that might be underreported, are living with more than one autoimmune condition. I talk to patients that sometimes have 5. And so just the complexity, kind of proliferates from there. But initially, that's where we're going to set our focus in determining where we can drive better outcomes consistently.
And another question, please.
Yeah, I'm curious. I think this is great work and it's definitely needed. I mean, this space is so disjointed and, care teams don't talk with each other. I'm curious, when you talk about your wraparound services and including coordinated care teams, are those care teams your clinicians or are they, the patient's rheumatologist or whatever? If you could just maybe explain that a little bit.
Yeah, so we're actually building out our own specialty network that's we're building right now, kind of comprised of a number of different specialty care providers. We think that will help us deliver better access kind of across geographies, but that is a consideration when a patient has a long-standing relationship with a particular specialist that they like. We're figuring out how do we embed that external care team member into the clinical flow and push and pull data accurately, so we're all speaking the same language. So that's something that's on the roadmap for 2022.
Great, and we have time for one more quick question.
Hi, Rory. Curious, it sounds like you've spoken with a lot of autoimmune patients. when kind of mapping out the platform. Curious to hear kind of what they were looking for in a product, and what D2C channels you hope to leverage to reach them.
Yeah, so that's a great question. I think there's a few things that really stood out. One was the ability to kind of take what they do on, paper notes and journals, by tracking kind of their symptoms and what's triggering their flare-ups and helping digitize that. I had a number of patients say, gosh, if I had, if I wasn't sick, I would have done something like this. I wanted to do something like this. And so happy to be able to kind of build that and make that vision come true. And then the second thing that came up really consistently was around community. I think when you live with a chronic illness, especially one that's considered an invisible illness, which is something we're trying to combat, is making people feel seen, heard, and felt is a core mission of ILA. And I think we're trying to do that by building a community around these patients.
Great. Thank you, Rory. And we are now up for our next seed company. If we could please welcome Caitlin.
Hi there, thank you. My name's Caitlin Christine, and I'm the CEO and founder at Gabby. Next. In 2012, my mom found a lump in her breast. She was getting regular mammograms. However, because she was viewed as an average risk woman, that was the incorrect screening for her. When she was finally diagnosed, it was too late. My mom died of a delayed diagnosis 8 months after her initial finding. Next. Shortly after my mom died, I found a lump in my breast, and I was only 22. Although I knew what questions to ask, how to advocate for myself, I still had to fight with my doctor to get the necessary screening. Eventually, I underwent what was supposed to be a preventative surgery, only to be diagnosed with breast cancer in surgery. I was 24. Next. Unfortunately, these two stories are not uncommon. This is happening to women every day all over the world. In fact, 26% of women diagnosed with breast cancer are under 50, and 85% of those women are diagnosed at late stages. Next. This is what it looks like for a woman under 50 to be diagnosed today. It can take her up to 64 weeks to get a diagnosis. And just like my mom, it's too late because the survival rate for a late stage diagnosis is 28%. Next. This is what it should look like. So at Gabby, we are decreasing the time to diagnosis, decreasing the cost of a diagnosis, and most importantly, turning breast cancer into a treatable disease. Because when caught early, the survival rate for this woman is 98%. Next. And that's what we did. Our twofold solution uses AI with our risk model, incorporating claims data and patient-reported data to identify the women who are at risk. Then our app provides personal action plans and navigates women to the necessary care. Next. We validated our risk model with a national insurance company earlier this year, proving that our risk model is the most accurate risk model to date. Next. And in that study, we found Mira. Mira is an African-American woman, mother of two, who was diagnosed with stage 4 breast cancer in 2018. But had she been using Gabby, we would have found her 2 years earlier. We are a wedge for early detection, ensuring every stage 4 is diagnosed earlier. Next. We will win because our inclusivity. We're the only risk model that is appropriate for women of all ages and all ethnicities. Accuracy, because we're the most accurate risk model. And approach, we're the first ever consumer-facing risk model. Next. There are a few competitors out there, but as you can see, they all have major holes. Next. We know that this is a really big market, but that doesn't intimidate us. Next. We're going to market with our phase 1 direct-to-consumer launch with 2 key partnerships. The Landbee, a concierge primary clinic in New York, and EHE, the industry leader of benefits management for Fortune 500 companies. Next. In phase 2, we will expand within EHE customers, as well as expand to directly to self-funded employers like Quest Diagnostics and Time Warner. Next. We're projecting 500K ARR for next year. Next. And we've had many early signs of traction, including our validation pilot with Anthem, winning Accenture's Rising Star of the Year award, and our oversubscribed pre-seed rounds with top-notch investors like Anne Wojcicki and Christina Farr. Next. We have really big plans for the future, and we're just getting started because we're not just focused on breast cancer. Next. Oh, seems like there's a few slides missing. Well, I was going to show you our team of advisors and our internal team. What I'll just say there is that we are an all-female leadership team, and 65% of our team are women of color. We'll be raising a new round in the new year in Q1. And just to leave you with the fact that from one of the most comprehensive books on the history and progress of cancer, The Emperor of All Maladies, early detection is really the only cure. And that's why women need Gabby. Thank you.
Thank you, Caitlin, and thank you for being a pro. Sorry about the slides. I would love to open this up to our judges, and I believe, Ella, you have the first question.
Caitlin, thank you for sharing, and wow, amazing early impact and traction from you and the team at Gabby, and I hope you'll enter the Canadian market too. Certainly the needs and the demographics are not that different.
Right.
I'm curious, kind of as you're thinking about scalability, like D2C, and I think you're choosing to focus there to start, which makes a lot of sense, but obviously scalability comes with the large payers and the large employers. What do you think from either the conversations you've had with Anthem or some of the self-payers you've mentioned are the key milestones that you need to show or KPIs to really be able to scale this, and how's the team tackling that?
Thanks. Thank you, Ella. Great question. So yes, we're starting direct to consumer. And I think like we've seen in most health tech, that it's really necessary in order to expand to the self-funded employers, to the payers. So as far as what they're looking for, we're really excited that we were even able to get this partnership with EHE. And we have a couple self-funded employers that we're already talking to that are really excited, but it's really from, we know that it'll expedite the sales process if we can show that women are using the app and show stats on the number of women that we're finding, as well as what type of actions they're taking.
That makes a lot of sense, and consistently we see D2C as a proof point for payers. So I think that your journey makes a lot of sense, and I look forward to seeing where you go.
Thank you, Ella.
Other questions from our judges?
Caitlin, you mentioned that you're not stopping with breast cancer. Could you expand a little bit more on that and share what other clinical areas that you'll focus on?
Sure. So really, we're going to be positioning ourselves first as your go-to breast specialist. But the way in which we created our risk model was so that it was generalizable. And there are many preventable cancers that are currently not being detected early enough. So we see colon as a big opportunity. We see endometrial, cervical, and really we see ovarian as the holy grail because it's the deadliest gynecologic disease.
Other questions?
I have a question. Thank you so much for your presentation, for your pitch, and everything that you're doing. My question is, could you share a little bit about the validation, a little more on the validation points from the Anthem pilot?
Sure. What would you like to know?
That was very clear. What I meant, what I'm is I'm actually really moved by what you're doing in your story. And so
thank you.
That's why I'm not as smooth right now. What I'm trying to ask you is, you mentioned that you had a validation pilot with Anthem, and I'd love to hear a little more about what were the endpoints and what you looked to prove and what you either proved and or realized that you'll work a little bit harder to figure out.
Awesome. Thank you for that question. No worries. Thank you. So yes, the goal was to prove that our risk model was more accurate. So we did a retrospective analysis with 30 million data sets, and we trained and tested the model during this study. And at the end of it, it was to show what were the factors internally that were indicating risk, and really could we predict a woman's risk within a 2-year period of time. So we looked at only women who had not had a cancer diagnosis, as well as women who had cancer diagnoses, in order to help train the model. And then we, at the end, showed, can we predict? And the answer was yes. And then with what accuracy, and what does that mean? So that's where we reached the 81% accuracy, and risk models that are used today at best reach 68. So we were far superior. And we also discovered a lot of other factors that are not really being considered that can, we think, predict a woman's risk of breast cancer.
Great. Thank you so much.
We have time for one more question quickly.
I have a follow-on if other folks are thinking. It's hard. I can't see. I don't want to be interrupting anybody. But I can do my follow-on quickly. Just at the end of the response, you said you identified some other risk factors some other risk factors. Could you share what some of those were?
Sure. Well, I think one I'll definitely share following the pitch we just had, autoimmune factors are some, anxiety disorders, age, personal family history of not just breast cancer, other cancers we know, but all the way out to 3rd-degree relatives, as well as some environmental factors. Obviously, we know weight is a factor. And then the 2 other big ones we were really excited about were menstrual and reproductive factors, as well as breast conditions.
Thank you, Caitlin, so much. Really appreciate it. So we are now up to our Series A companies, and the first up is Amy. So Amy, we would love to hear about your company.
Thanks, everyone. My name is Amy Devania, and I'm the CEO and founder of UFA, a new at-home diagnostics company. Next slide. I was really excited to be a mom. And as a woman with irregular cycles my whole life and a PhD in biomedical sciences, I knew it was going to be difficult, but doable. However, it was a lot more difficult than I ever expected. After 18 devastating months, I conceived my beautiful baby boy. Realizing that 1 in 8 couples experience fertility struggles, I took what I learned from my journey and founded UVA. Next slide. Couples experiencing difficulty conceiving are limited to 2 options. The first are inexpensive and inaccurate. In a survey we conducted of over 600 women, 73% of women did not conceive, even after using these products for an average of 6 months. None of these solutions are meant for women with irregular cycles, and that accounts for 2/3 of the female population. This leaves the majority of women left with option 2, which are expensive and invasive procedures. Next slide. As women are trying to conceive later in life, they find themselves leaning to these options more and more. The problem is, at this point, every day matters. Women underrun treatments for 8 months on average before moving on, and the cost is massive. A majority of women spent more than $10,000, while the remaining spent more than $20,000. Next slide. The bottom line is we deserve better, and UVA is making that happen. We have created a tool that provides clinical level accuracy in the privacy of a woman's bathroom. Our solution is affordable, convenient, and non-invasive. Next slide. A woman simply orders an UVA kit. She will receive a handle, holder, and 1 cycle's worth of disposable test strips. Each day, she will provide a urine sample on an UVA test. She then scans the strip using the camera directly on her phone and receives the results in her app within seconds. The app will report her hormone results and a customized daily action plan. She will be informed of her most fertile days and confirmation of whether she ovulated. If a woman is working with a clinician, her clinician will receive the daily results in their HIPAA-compliant UVA dashboard. This enables everyone to be part of a more comprehensive conversation. Next slide. UVA truly is set apart from the competition in the fertility space. No other product provides actual hormone concentrations, accommodates women with irregular cycles, confirms ovulation, and shares the data with their healthcare providers in real time. And we are being recognized for this as we won the 2021 CES Innovation Award. Next slide. UVA has a unique go-to-market strategy that is coveted and untouchable by our competitors. We have engaged with clinicians who offer UVA to their patients and use the data to directly inform care. We have 179 clinics in the pipeline and are about to engage with the healthcare system that will be adopting UVA's platform across its 18 hospitals. We feel confident in our model because we have almost a 75% conversion rate. To date, 88 clinics from Mount Sinai Hospital in New York to OC Fertility in California are integrating UVA into their practice. Clinicians are finding our platform and especially the data to be incredibly helpful. It's creating a symbiotic relationship between the patient and clinician, where women get to take control of their own health and our data is directly informing medical care. All the while, we have a direct-to-consumer stream running in the background. Next slide. Our price point is extremely accessible for the greater population. We have set up a subscription model that results in recurring revenue with a 69% retention rate month after month. Regardless of whether the customer comes to us through a clinician or directly, they pay for the UVA kit. Next slide. While UVA is currently focusing on fertility, we have built a technology that is scalable to additional areas of health. Our next product is moving directly into menopause, and we will be growing into other healthcare spaces shortly after that. Our model to monitor, learn, and intervene is easy for us to repurpose in other areas incredibly quickly. Next slide. UVA's team is small but mighty. We have some of the most dedicated people working for us who are experts in their respective spaces, and our hard work is paying off. We have impacted families by helping them conceive, but more importantly, we have educated and empowered women with information about their bodies so they can finally take control of their own fertility journeys. We are changing the future of fertility by making the journey less complicated and affordable. Next slide. My ask of the HitLab community is to connect us with other hospitals and potential partners who would find our technology helpful. We raised our seed in March 2020, right before New York City shut down for the pandemic, and we'll be going out for our Series A in March 2022. On that note, I'm happy to answer any questions you may have.
Thank you, Amy. Perry, I believe you have the first question.
Yes, thank you, Amy, for a terrific presentation. It's honestly great to hear more about, kind of your mission, your team, the exciting business model that you're, really pushing forward here. That's both, obviously very thematic right now with the boom in at-home testing, but a lot of, very exciting additional use cases down the road, like you mentioned, like menopause. So, it's really great to hear all about that. My question kind of relates to, it's one thing that we've continually heard is that, there's an expectation that private payer coverage of fertility benefits should hopefully get better over time in the coming years. It's relatively poor today. Just curious how you envision that potentially impacting kind of UVA and maybe how you kind of set up your revenue model specifically.
Sure. This is something that's really at the forefront of our minds because the argument is so clear, right? Would a payer want to pay for a $15,000 IVF cycle or 3 rounds of UVA at, let's say, an average of $120 a month? It's really a no-brainer, right? So with the hospital network that we're kicking off with in the new year, they are actually running this test for us. We want to get that data of what the not the accuracy, but what is the success rate from going from using UVA to either a direct procedure in the IVF clinic or to a solid pregnancy naturally. And that data is going to be critical for us to take to a payer and make a really solid case.
Thank you. Next question.
I can jump in with a quick one. How are you thinking about customer acquisition and customer education in a pretty busy landscape?
So this is a really great question because I thought this was going to be a massive hurdle for us, especially when we were originally thinking of going solely direct to consumer. The fact that we went B2B2C first has really helped us with that customer acquisition piece. Basically, all of these clinicians that are joining our team are becoming my extended sales channel. So I'm not convincing patients to use UVA, it's my clinicians doing it. And if your clinician tells you to not go buy an ovulation kit, but go buy UVA because I can see your data in real time, because I can monitor you every single day, all of a sudden you're already 80% convinced to purchase that product and you are going to my website to learn more about what you're actually buying. So it's been really easy for us to kind of cut through that noise because we have that validation through the clinician channels already.
And Amy, on that note, can you share a little bit more about how clinicians are making use of the data that's available to them via UVA?
Yeah, sure. So this has been so enlightening for us. We originally thought that clinicians would find use in Nuva for their problem patients who had really irregular cycles and they had no clue what was going on. That has quickly scaled to now being supplementing IVF treatments, removing some of the excess blood draws that patients have to go through, supplementing IUI, figuring out Clomid dosage. An interesting case that we recently had was through surrogacy. Surrogates were still faxing their reports because usually the surrogate is across state lines. So this UVA actually enabled them to provide the results in real time. It's just been really enlightening to see how clinicians are using it. One really common use case is actually monitoring the progesterone post-ovulation to make sure it doesn't drop below a certain level so that they can actually intervene sooner than seeing a possible miscarriage happen.
No more questions? That's always a good signing. All right, we're ready to move on to Mylene, our last finalist in the A category. Stage is yours.
Great, thank you. Hi, I'm Mylene Yao, co-founder and CEO of Unify. I'm really excited to be here today as a finalist in this HIT Lab Women's Health Tech Challenge. Next. A quick background about myself. First, women's health and in particular fertility care has been a big part of my life. First as an OB/GYN seeing patients with clinical fertility, and then as a scientist and academic researcher studying the genetic control of embryo development and early pregnancy. As part of the 1 in 8 statistics, I experienced fertility treatments firsthand as a patient, and I'm grateful to be a mom. Now, as CEO of Unify, I'm seeing the pain points faced by patients, employers, and health plans and providers as stakeholders in fertility care. Many aspects of fertility care are broken in our healthcare system. The game changer is in using personalized prognostics. The word prognosis means knowing the probability of treatment success. Prognosis, diagnosis, and treatments are the foundation of medicine going back to ancient Greece. Today, we have the technological capabilities to use AI and machine learning to personalize prognostics and make patient counseling much more effective and actionable. I co-founded the company with Professor Wing Wang, a world-renowned biostatistician and expert in AI and machine learning, to build Unify to deliver on that vision. Next. Unify is making fertility care more affordable, successful, and predictable. We're leveraging AI and machine learning to personalize counseling so that women and couples can get to the treatment they need without wasting time and money. Next. The fertility market, as you know, is projected to reach 48 billion by 2030. 10 million women or couples need fertility care to have a family, and globally that number is 100 million. IVF is the most effective and safest treatment available for most patients, and we're really talking about patients who have not been successful with any other means, and over 8 million babies have been born from IVF. Next. The problem is that less than 3% of these patients use IVF, and most patients cannot afford several cycles to maximize their chances of having a baby. IVF costs $10,000 to $20,000 per treatment, and on average, about half of the patients may need 2 to 3 cycles in order to be successful, and some of them may not succeed even after 3 treatments. Most patients do not have full insurance coverage, and the out-of-pocket costs are significant. No other consumer paid service has this degree of financial risk. Patients are emotionally and financially devastated after one failed treatment. And in that situation, from our firsthand analysis, most patients drop out of treatment without realizing their chance of having a family. Next. The Unify AI machine learning platform is highly scalable and predicts clinical outcomes that are validated specifically to each clinic. The Unify platform hosts a full suite of AI-assisted tools and products to support patients and providers to reach a successful outcome. Our flagship product is the Unify Pre-IVF report. Next. This Unify report is used by fertility specialists today to counsel patients based on personalized and accurate IVF success probabilities to inform treatment decisions. Next. Next, please. Patients counseled with the Unify report are 2 to 3 times more likely to use the recommended treatment, and we expect to see the number of live births also increase by 5-fold as a result, and that analysis is underway. Next. Fertility centers realize significant ROI from the increased volume and efficiency. Next. Our proprietary technology allows providers to offer value-based pricing programs to most of their patients, And that means capping financial risk, giving cost savings, and making multiple IVF cycles affordable. We're now translating this cost savings to health plan members by working with health plans and employers. Next. I'm raising our Series B round, which is gaining a lot of momentum. Unify has a unique, highly scalable AI platform. We are commercialized in the US, Canada, and EU. We have the largest, most diverse global database of IVF cycles, and we've performed modeling for over 250,000 IVF cycles. We've mapped fertility service utilizations for over 90,000 women, and we have an extensive global IP portfolio with patents issued in the US and around the world. Our products are compliant with HIPAA, GDPR, and FIPA, and our product is also CE marked as medical device software in the EU. Next. Our Series B plan is that we're growing Unify by expanding our provider client base, extending services to health plans and employers and benefits programs, and developing novel genomics products. I'm interested to develop partnerships with employers, investors, and strategics in commercial and R&D directions. Thank you.
Thank you so much. I really appreciate that. And Buffy, I believe you have the first question.
Thank you for your presentation. What you're doing is much needed. Obviously, all of these spaces haven't been innovated in for so long. So I'm curious a little bit about how you compare to other competitors out there that are doing this. What's your differentiation amongst them? And if you could just
right,
describe that.
sure. So actually, our AI machine learning platform is the only one in the market. The reason there's AI machine learning applied in many different clinical scenarios, but we're focusing on patients that have already tried other treatments, are not successful, or are good candidates for IVF treatment and are considering this treatment and want to know what are the benefits and limitations of IVF, so that they may decide whether to proceed with IVF or proceed with IUI or other alternative treatments. And today, this is the only platform that supports this level of clinical decision making by patients and doctors. And our prediction model is actually based on clinical IVF data and outcomes from each IVF center that's participating. And this clinic-specific validation is really important more and more as you look across medicine, not just fertility or women's health. There's really more and more reports saying that AI and machine learning really needs to be validated regionally and to very specific patient population. And that is what we started out doing from the beginning, because we already know from having analyzed data from across the US and also around the world that patient populations data are very, very different. And so these clinical models need to be validated to each clinic.
Can I just add a follow-up to that? You mentioned in your presentation that you expect to see 5 times more live births as a result of women using your services. Can you explain a little bit about the variables that would lead to that statistic?
Right. And so the variables that are used by the machine learning model include age and other lab tests such as AMH, anti-Mullerian hormone, which indicates ovarian aging. And also, in some cases, if clinicians use ultrasound as well with follicle count. And it also includes reproductive history, such as whether a couple had a baby before or had pregnancy losses before, and clinical diagnosis. So for example, if PCOS has been diagnosed, endometriosis, male factor, and if semen analysis results are available, male partner data would also be included. And there are also additional factors. And it's not a hard and fast list because we're also very adaptable. This is machine learning. If a clinic has been gathering data in their data set on additional variables, we would be able to analyze those as well. So it's not really dictated or mandated. But what we have found is that when you take this kind of 360 holistic view of the incorporating all these data points, rather than just focus on age-based prognosis, what you're going to find is much more accurate, much more personalized prediction. And that, so when the patients actually use the Unify report, when their doctors are counseling them, what they get is accurate personalization and transparency. And having those attributes in their clinical counseling has been, I think, a big factor in helping patients move forward with recommended treatment. And so, so the 5-fold increase in live birth comes from several things. Comes from more women just acting on the recommendation by their doctors, first of all, and proceeding on to treatment even. And then second of all, that they feel more confident and they have more transparency so that they are able to go forward with a second or third treatment if the first one fails. And that those two factors combined together leads to dramatically increased live birth that we're expecting. And that analysis is underway. We've analyzed data from several clinics already, and the results are, really striking. And of course, we also really focus on, we're not saying the report causes live births or leads to live births, but is an association. So just be scientifically, very objective about this. And so we're really excited, and we're expanding that analysis now to include more and more clinics to be able to give transparency, back to doctors and patients.
Thank you. Thank you for your presentation. So huge thanks to all of our esteemed judges and founders. And we are now going to invite our judges and finalists to return to the event, and the judging scoring begins. So would the judges please join the Teams meeting that Nicole sent you for your deliberations. And again, congratulations to everyone, and thank you so much.